Hi everyone, I'm Sakamoto. Today, I'd like to talk about hip osteoarthritis, which is common in women. The first topic is what hip osteoarthritis is. Here's a front view model of right hip joint. This is femur, the thigh bone. This big part is called pelvis. There is also an acetabular roof above the femur. The hip joint consists of an acetabular roof and a femur. Hip osteoarthritis is induced by the worn cartilage and unsmooth joint, resulting in pain and difficulty in walking. There are two causes for hip osteoarthritis. The primary cause is that the joint is broken without any apparent cause. The secondary cause is that the joint is broken due to illness or injury, which accounts for the majority. Among the secondary causes, congenital hip dislocation and acetabular dysplasia account for 90%. Perthes disease and osteonecrosis of the femoral head are also mentioned as the secondary cause. Let's see the cause of congenital hip dislocation. Previously, babies kept their legs and knees stretched when wearing a thin diaper. Today, they are used to wearing large diapers with their legs spread. In this state, the hip joint is stabilized and less likely to dislocate. When babies wore diapers with stretched legs, they often got hip osteoarthritis as they grew up. Acetabular dysplasia is the deformation of the hip joint due to incomplete development of the acetabular root. To diagnose hip osteoarthritis, X-ray examination is often used. In these photos, you can find that the hip joint on the left is deformed. The deformation of the acetabular roof and the tip of the hip joint make the joint quite unsmooth. There are two treatment methods, the conservative method and the surgical method. The conservative method is to control body weight and refrain from going up and down stairs to ease physical loading. Taking internal medicine and performing workout or stretching for rehabilitation also help to relieve from pain. If the pain in hip joint gets so worse that you can't walk for 5 minutes, the surgical method is required. This method has osteotomy and total hip arthroplasty. Osteotomy is for those who have mild deformation and movable joints. The target will be those between the ages of 40 and 60. Total hip arthroplasty is for those who have severe deformation that is not curable with osteotomy. In addition to these two conventional methods, there's regenerative medicine that is recently attracting attentions. There are two options. One is PRP therapy for the hip joint. Another one is stem cell therapy, injecting stem cells derived from fats. In this stem cell therapy for hip joints, a little amount of fat is taken from the patient's joint. Then, cultivate the stem cell and the fat to 20 to 50 million in about a month and inject them into the joint under ultrasonography. The injection helps to repair broken cartilages and increase the number of cartilages. As the number of cartilages increases, the pain is mitigated significantly. In the PRP therapy, 10 to 20 cc of the patient's blood is collected, and the PRP in it is extracted with centrifugation. The PRP is then injected into the joint under ultrasonography. Unlike stem cell therapy, the PRP therapy doesn't have a stem cell. Therefore, it cannot produce cartilages, but relieves pain by repairing the broken cartilages. Today, I explained about hip osteoarthritis. See a doctor near you, or leave a comment below if there is anything unclear. Thanks a lot for your attention!